people who live with RA never know when the next flare may come. And that's tough. You try to plan a vacation. You try to plan an important life event like a wedding. The more stress there is that's going on, the more likely it is that you may go into a flare. If you live with RA, you understand this. This is a fact of life. And it's kind of a tough fact of life. So I don't think we should be surprised that anxiety is higher overall. I think what's encouraging is to see the many ways that people learn to adapt and to cope and to keep moving forward despite this. Now, all of this became incredibly important when COVID struck. And we were really fortunate because our measures were well underway. Patients have been completing them for a number of years at the time of COVID. We understood how well the measures worked, and now we had information from patients that could be used by the rheumatologists when the early days of COVID prevented those in-person visits. So if you remember, going back to March of 2020, there were all kinds of concerns that people with autoimmune diseases were more vulnerable because of immunosuppression, that the drugs were not going to be available. And in fact, there was a lot of concern initially about shortages, that so many visits had to be postponed or held over the telephone. And now we were in a position where rheumatologists couldn't look at your hands specifically, squeeze them, understand what was going on, but had to rely on the reports of patients. We felt very confident that we had all of the data that really suggested that the patient reports were very reliable, robust, and the next best thing to having that in-person visit. So because we were collecting these questionnaires regularly from patients, we had all kinds of information before the pandemic, and that became incredibly important once the pandemic struck because we could look at things. One of the things that I was most interested in is looking at how the pandemic was affecting mental health. And we found some really interesting findings. So first of all, when the pandemic struck, the good news was that most people in Catch did well. 60% of the cohort, their mood was good, their levels, their scores for anxiety and depression were well within the normal range. We saw the resilience. Despite the added pressure of having an autoimmune disease and facing COVID, most people were coping pretty well. There was a small group, about 8%, of people who were struggling before the pandemic, and they continued to struggle during the pandemic. That's not surprising. There was another group, about 8%, who actually got better. Their mental health improved. Now, when we noticed that, we were kind of intrigued with it. And so when I dove a little bit deeper and spoke with some of the patients, they would tell me things like, for me, it's great not going into work. I actually prefer working at home and not having to fight traffic and not having to make small talk in the halls. So there was a group of people for whom the pandemic and the shift in our lifestyles really made a difference. But then there was this surprising group, and it represented about 22% of patients with in the Catch cohort. That 22% started out fine. So their mood was where we expected it to be. No real anxiety, no real depression. But we followed them over 2 years. And what we found is that both anxiety and depression steadily increased. And that's the group that I think is at the biggest risk, or was at the biggest risk initially, because they looked like they were coping very well. They looked like the rest of the 60% who were just fine. And that's probably the group also for whom doctors stopped checking in with them. How are you doing? If you got through the first year, I think the assumption was, we don't need to worry about you. But in fact, it wasn't going well. And it seems like it was the cumulative burden, wave after wave after wave of COVID, seeing no end in sight, waiting for the vaccines. All of those things that people lived with over time did seem to take its toll. I was surprised by the size of the group, But I also saw it as a real opportunity to make the rheumatology community aware and to make sure that everyone was checking in on a regular basis, just to make sure that we understand how people are doing, especially if you look like you're doing fine in the beginning.